There's disruption everywhere we look.
It's critical. I think it is career-changing.
So it was a real problem and it needed a solution.
Healthcare in the United States is evolving, and the future of health law requires a multifaceted team that works together for the greater good. In today's world, the health law professional is a vital part of this team, yet this concept is not new. In fact, it's a long-standing tradition of St. Louis University School of Law. The role of education in health law is changing, but the mission for St. Louis University remains the same.
At the heart of our work is to teach our students and to turn out health law professionals who will also be of service.
Ensuring the success of future health lawyers and in turn better population health requires taking interdisciplinary education to the next level.
We want health lawyers who know how to work with doctors and with nurses and with public health people, not just in a lawyer-client relationship, but as part of that working team that comes up with solutions that are informed by that interdisciplinary perspective. I think what we really want is what's called a transdisciplinary perspective. Not just two disciplines maybe talking to each other, but learning how to work together and inform each other. It's kind of moving it the conversation one step forward.
It's how students become professionals, then collaborate across disciplines to build teams, helping everyone involved become better problem solvers. Ultimately, it's the realization of why the future of health law is team-based.
Health law is a place where the law, politics, and culture meet a fundamental human need.
And for health law professionals, the center of the need is the community.
The law is changing, policy is changing, it's moving in the direction of recognizing that individual providers owe something back to populations, that we as individuals owe something to our communities in terms of preserving health. In 2030, the volume will be turned up on that even more than it is now.
Ruqaiijah Yearby is turning up the volume now to make sure the next generation of health law professionals understand they must work closely with their communities.
And so you can't uphold the law, you can't do your job unless you're connected to the community you're trying to work for.
She works to expose how law perpetuates inequalities, looking at disruption through the lens of structural racism. And she makes sure her students get the point by tracking laws and publishing their impacts.
Change it, and most importantly, center community in it.
She also insists on highlighting the strengths of those communities.
And that's one of the things that we're trying to change at the Institute, is not just focus on the deficiencies, but focus on the strengths. What are people doing to survive? What can we learn from them?
We have so many faculty members with so many different lenses to bring to disruption.
Young health law leaders learn from faculty advocacy, scholarship, and research.
It's really at the intersection of all these areas, and I think that's how SLU has innovated. That's how I think our students are being prepared for tomorrow.
To see for themselves the growing trends in health law through in-class and outside of the classroom experiences, they call it service learning.
And service learning is just a method of teaching that brings in lessons learned from community service into the curriculum.
Elizabeth Pendo's students used the law to provide access to sidewalks for those with disabilities, helping solve problems in the community while in school by utilizing one of the main characteristics of the entire health law field going forward.
Working in teams, working effectively with experts in other disciplines.
Real-world learning experiences combined with access to professionals already in the field.
And I think that's in part legal education. As legal education has grown up, it's moved out of the classroom generally, and it's moved into giving students a chance to work with the law on the ground.
But also making you nimble, right? Because what we're teaching you about today will change. We can promise you that.
Students, professors, lawyers, and community members working together to drive health law innovation.
And that's the richness of health law, that it draws on so many different areas, and you get the opportunity to talk about how do you respond to disruption from a lot of different frames.
A cornerstone of SLU's program is its approach to teaching health law and mentoring faculty, alumni, and colleagues around the country. And its mission to share knowledge for that greater good has a wide-ranging impact, not only for its students, but also its collaborative service learning and research projects.